Oh, hello. Is everyone here? We'll start. So everyone, welcome and welcome to the third webinar for our CELG. As you know, CELG is an online community for us to share our experiences during the pandemic, as well as to determine how best we can support our key vulnerable populations and last mile populations in terms of them engaging in pandemic governance to prevent pandemics, as well as to manage the risks of the risks and its effects of on the services and the programs of our organizations in case a pandemic happens. So let's just to get a recap and just an overview of this session, I will just share the program for today and the objectives. So the purpose of the webinar for today is to provide the participating organizations a platform to share proposals on how to strengthen the capacities of partner key vulnerable groups and last mile populations to engage, participate in the governance of pandemic prevention, preparedness, and response processes. So we'll have several parts today. We'll have a recap of the lessons learned as you guys presented last week, and then based on those lessons that we want to build up strategies on how we can better improve our services and program management in case another pandemic happens, and how best our key vulnerable populations and national populations can engage with governments and other agencies that manage pandemics. So we'll have Olive from the Global Fund to discuss how the Global Fund manages or attempts to help local communities and countries to participate in pandemic governance through their frameworks and their initiatives. And then we'll have a recap of the projects that are currently on process or in development among the countries that are funded by the Global Fund. We have 3 countries to present today. We have Mozambique, Cameroon, and Cambodia. Do you have questions for our activity today? None? If none, then we can proceed with the recap of this last webinar. Let me just are you still there?
Yeah.
Okay. Can you see my slides now?
Yeah.
So just a recap, we for the last session we had 3 countries and 1 regional network presenting on their experiences and lessons during the pandemic. So we had, for the Southeast Asian Regional Network, we had APCASO presenting their study regarding how services were affected among the countries that they were working with. For the countries, we had Indonesia, represented by Jakarta, Indonesia Positive. For Sierra Leone, they were represented by SISMAT. And for Nigeria, they were represented by Jana Health Foundation. They had shared experiences, including the disruption of program administration and service delivery, particularly because there was inadequate preparation and planning, as well as coordination, initially with governments and other agencies. And this was because there was limited engagement in pandemic governance, especially with governments, initially on the onset of the pandemic. The following lessons were learned during the pandemic based on the reports of the countries. One is that there is a need for contingency planning for possible disruptions. Included in the plan for contingency planning is the allocation of resources and the provision of mechanisms for reallocation at all levels. Disaster risk management, including that coming from the risks of pandemics, should be part of the perspective in development planning. The second lesson learned is that there is a need for institutionalization of spaces and platforms for multi-level and multi-sectoral coordination, especially with and among governments, and the inclusion of vulnerable populations in preparation for and in response to pandemics to ensure that community responses are aligned with the national strategies and that the needs of vulnerable groups are integrated in mandates and protocols. The third lesson is the need for organizational flexibility to adjust program administration and service delivery processes and mechanisms, including those focused on engaging and empowering communities, key vulnerable populations, and last mile populations. The fourth key lesson that we had from the last session is that there is a need to improve data collection and management to be used as basis for decision making for policy and program changes during the times of crisis and the shock when a pandemic happens. And lastly, there is a need to strengthen the capacities of communities and vulnerable groups to provide basic services as well as engage in governance of health programs to better handle the shocks to the health system in times of crisis. So these were the lessons that we got from the last 3 presentations. For this session, we will try to learn how you guys, how the different organizations, as well as from the Global Fund level, how are we trying to apply these lessons? So do you have questions?
Can you put for me in the what? In the bag there.
What?
Yeah.
Jerry, I think you just need to mute the person.
Oh, okay. Okay, thank you. So now we'll proceed to the next part of our webinar. We'll have the presentation from Olive to present the Global Fund Pandemic Governance Capacity Building Framework. Are you ready, Olive? I will be presenting your slide.
Thank you so much, Jerry.
Let me just...
As Jerry puts up the slides, just for introduction, my name is Olive Mumba. I work within the Community Rights and Gender Department in the Global Fund. I'm part of the community engagement team, and I'm an advisor, community engagement, COVID-19, but right now I do a lot of work around pandemic preparedness. I've also been supporting a lot of work around TB and TB key and vulnerable populations regional networks. And right now, I think most of us are already engaged within the community engagement and leadership in pandemic governance. So Jerry, maybe we can move to the next slide, please.
Okay.
I am online is my colleague Gavin, and I think also working within who leads the team for the community engagement team. So it's a pleasure for us to be presenting this these few slides. Just when Jeff reached out, the question was, what is the Global Fund doing around community engagement, and especially when it comes to pandemic preparedness and response? So we put together just a few slides to take us through, but to remind us, first of all, is the strategy for the Global Fund, which puts people at the center. And you would see around black box, which is around working with and to serve the health needs of people and communities. That is the main emphasis that the Global Fund strategy works on. However, when you look at the mutually reinforcing contributory objectives, the one in the middle talks about maximizing the engagement and leadership of most affected communities to leave no one behind. And this aligns with the strategy, with the SDGs. And when we look at the evolving objective, we have seen what COVID did. And right now we're talking about moving from COVID and shifting to pandemic preparedness. So within the Global Fund, we have an evolving objective, which is around contributing to pandemic preparedness and response. And all of this is through a partnership model. Thank you. Let's move to the next slide, please. In this slide, we will note that WHO earlier this year announced the move, that COVID is no longer an emergency, but what most of the global community did is now started looking at how do we prepare for the next pandemic, because what COVID did is show us that at any time we should be prepared for any eventualities or emergencies. So even for the Global Fund, the shift has also moved, now transitioning from COVID-19 response to recovery, prevention, and preparedness. And you will see the circle talking about preparedness so that we are able to respond, and when an epidemic hits, that there is fast recovery, but in the same process, also making sure that we are preventing and mitigating any effect from any pandemic that can come. So within the shift also has moved from now from the control and containment intervention, and I think this was through the C19 response mechanism that we all may have heard about. But right now, the Global Fund is now moving towards transition planning that is increasing its focus on integrating key response functions, and especially when it comes to health systems, resilient and pandemic preparedness, that this should be emphasized. And as we talk about preparedness, it's looking at both health and community systems, and that these should prepare programmatically, and that the set priorities that the Global Fund has come up with. And I think these priorities are in the next slide, which are fivefold. The first one, looking at surveillance systems, and this is around making sure that they strengthen surveillance systems, ensuring that they are, the second priority is around laboratories and diagnostics. The third one is around human resources for health, and which includes community system strengthening. The fourth one is around medical oxygen, respiratory care, and therapeutics. And the last one is around health product waste management system. Key for civil society and communities is the third one, which is around human resources for health and community system strengthening. However, it is always good to also be able to participate and understand what's happening around these 5 key areas. These are 5 key areas around within the community, within the COVID-19 response mechanism. So the next slide will show us specifically when we talk about the third priority, and when we're talking about community system strengthening. And we are now talking about 4 key areas. This is community capacity building and leadership development, community-led monitoring, community-led advocacy and research, and community engagement, linkages, and coordination. These 4 key areas, key intervention areas, have to integrate 2 components, 2 key critical components. The first one being gender-based violence. As we knew and as we saw what COVID did, it propagated a lot of gender-based violence and intimate partner violence. So what is being encouraged here is that gender-based violence should be incorporated within health systems and community systems, and ensuring that the most vulnerable communities have access to services even when pandemics are hitting. And these are mainly the marginalized and criminalized communities. And then the second component talks about community-led monitoring for pandemic preparedness. Most of us have seen what community-led monitoring initiatives are doing, looking at service provision and really talking about how to improve quality of services, quality, access, accessibility, and all the others. But now, when we're talking about community-led monitoring, pandemic preparedness, this talks about human rights, being able to monitor human rights abuses, being able to look at health policy, resource allocations, and also complete grievance mechanisms, and also just trying to look at capacities that adapt to respond to disease health outbreaks, whether they are functioning well or there is a need to improve. And within the C19RM, specifically, there's the portfolio optimization 2 that the Global Fund is just under, just currently finalizing. These are the key components when it comes to community engagement, making sure that these components have been incorporated within the C19 country grants, or in also the opportunity of incorporating this within the GC7 grants, and especially when it comes to the mitigation component. Key to note is that these intervention areas highlighted here are specific to systems capacities and capabilities for community-led and community-based organizations. and that gender and human rights related aspects of pandemic preparedness must be considered across all the relevant domains. And those are the 5 critical areas that we just went through. If we can go to the next slide, please. Now, this slide it talks about what the Global Fund has been doing from the time COVID came, that is 2020, 2021, and 2023, and then looking at way forward. In 2020, there was the first funding provided to the countries, where countries were allowed to reprogram, but also there was some additional funding that was given to countries. And during that time, it was a very fast process. But what we learned, the CRG team conducted a survey, and what we learned was that there was no there was limited technical assistance. There were opportunities for consultations were very limited, and there was access to information, and timelines was very limited to communities for them to engage. And as such, there was some funding that was set aside, and through the Community Engagement Strategic Initiative, there was technical support that was provided. And there was also some changes in the materials that which also emphasized that community priorities should be an annex to the C19IM funding request. And after that process, in early 2022, there was another survey that was conducted, which again showed that there was a lack of inclusion of the broader impacted, most vulnerable communities. And as such, there was a proposition, and through the C19 RM, the centrally limited funds, there is a project actually that is now currently being run, and I think we'll hear more about the assessments that are being conducted. I think that's what Jerry had mentioned. But what I just wanted to emphasize here is that from COVID-19, one key lesson that we learned was the need to address human rights and gender-related violations, and this can only be done if community responses are integrated into programs. And that another lesson was that there's a need to build community trust, and this community trust can only be done once we are able to ensure that communities engage in all processes. As such, there was a need to make sure that communities are engaging in decision-making and oversight. But as we move, and colleagues will talk more about CELG, as we move to 2024 onwards, and especially with the shift from shift towards pandemic preparedness, there is a need for future pandemic preparedness and planning processes to include communities. The next slide, please, which I think should be my next slide, my last slide. If I can have the next slide, please. Oh, that was actually my last slide. So just to emphasize that, thank you so much, Jerry. Just to emphasize that as we move forward, the Global Fund is also taking into consideration the needs to make sure that communities are engaged, especially most vulnerable, marginalized, criminalized communities, understand processes that are happening at country level and engage in those processes, and broader than just within the governance, but other PPR processes which are currently happening at national level as C19IM is being implemented. Thank you very much, and back over to you, Jerry.
Thank you, Olive. As an outsider, haven't worked with Global Fund before, I would just like to ask, especially with the PPR literacy and the pandemic preparedness activities, are there specific programs that the Global Fund is directly working with local communities, or are your actions or are your efforts directed to helping local or national level organizations to capacitate local communities?
Thank you so much. There are two angles. One, the first angle is what I mentioned, the COVID-19 response mechanism. And there are those 4 key areas that were in the slides, which were which are community system strengthening interventions. So what the Global Fund does is it encourages country grants to incorporate community-led interventions. So that's number one. But however, there's this there's centrally limited investments where we are working with ACT Asia Pacific and ACT Africa around the community engagement and leadership in pandemic governance. So those are the two key areas. And then I should not forget to mention, even within the core grants, like right now we're moving towards GC7, it is encouraged that all community interventions are also integrated in there. So those are the three key areas.
Thank you for the clarification. I clarified that because I wanted just in case an organization tries to work with you, at least they know what the framework is and the overall goal which we want to contribute to. Thank you, Olive, for the presentation. Do the other participants have other questions? If none, okay, we can proceed with the country presentations. But thank you, Olive, again. But before we go to the country presentations, we'll have a recap of the projects that are being funded by the Global Fund. So we'll have Rachel Otto of ACT Africa to present us with a recap of how the planning process is being done and what type of projects are being funded by the Global Fund under the current under the CALG. Are you ready?
Thank you very much, Jerry. So I'm waiting for my slides.
Slides, okay. Share screen.
Thank you very much, Ole, for such an extensive overview. So by way of background to this community engagement and leadership in pandemic governance, CELG project, ACT Africa, ACT Asia Pacific, the Global Fund, and Stop TB Partnership developed a scalable community engagement model basically to reach the last mile population / TB key and vulnerable population, especially learning from the impact of COVID-19, most importantly, but on how to handle future pandemics. So this morning from Accra, Ghana, my presentation will be on the recap of community engagement assessment tool and the plan development processes. Next slide, please. So the outline for my presentation is to look at the objective of the tool, the process of conducting the assessment, and then basically slides into what the tool entailed, because I have just 5 minutes. Next. So the objective of this project or the assessment was basically to identify barriers, opportunities, and provide recommendations. This is a way of strengthening the engagement of the last mile population, for future pandemics. Secondly, to collect information on the structures and processes that exist, basically to identify opportunities for engagement. And then thirdly, to collect information on the key partners working with the last mile population. And then lastly, and most importantly, to develop an engagement plan to be developed at the national and the sub-national level. Basically, next slide. So the process of developing the tool and then the implementation. We had a pre-assessment preparation. This is where we engaged the global consultants. There were various multi-stakeholder orientation meetings. We had the multi-stakeholder steering committee, and then we had orientation of the tool to the country teams. And secondly, there's the community engagement assessment. This is where the survey and then the survey was done, and then finally reporting and then implementation. So for the reporting and implementation, we're looking at the assessment tool and then the action plans, and also the implementation of the assessment recommendations. So next slide. So this is just in a tabular form to make it easier to understand. So the pre-assessment pre-assessment preparation, all that we did, the community engagement assessment, conduct surveys, focus group discussions, key informant interviews, and then the pre-validation focus group discussion. The pre-validation focus group discussion is to be done after the analysis of the report. So the data analysis and reporting, and then the country level validation meeting, and then finally the report launch and the dissemination. Next slide, please. Now, the tool that was developed entailed 4 data collection tools. So we had the survey questionnaires, the focus group discussion guide, the key informant interview guide, and then the pre-validation focus group discussion guide. Now, the survey questionnaire were divided into subsections. So we had the structured and semi-structured questions, the SWOT, the community engagement assessment matrix, and then the open-ended question. Now, the aim of this was basically to understand the last mile population, how they were structured and coordinated, and also understand the TB response, the actors involved, the structures, the challenges and barriers in engagement of these last mile population in TB response, and of course, recommendations for effective engagement of the LMPs in TB response. Please pardon me if I'm using LMPs and then TBQ and vulnerable population, it means the same thing here. Next slide. Now for the focus group discussion guide, the focus was on 3 focal group discussion, which were the youth, the adults, and then the, adults between 30 and 64, and then adults 65 plus. This was the guide for the focus group discussion. Next slide. And then for the key informant interview guide, individuals selected were basically, we're looking at government and partners, stakeholder agencies. The sample size, of course, depended on the estimated population size. And then we preferred people working with LMPs engaged in the TB response and or part of the COVID-19 PPPR platform. And as I said earlier, the pre-validation focus group guide was done after the preliminary data analysis and draft reports. And the purpose of this is to seek input from final reports. And the size of the meeting and procedures were flexible to allow representation. Next slide. Yes, so the tool also came with some appendices. So it came with a costed community engagement where the country partners were supposed to fill in and submit. It came with terms of reference for the country consultant. It came with steering committee action plan where the country partners are supposed to also fill this in. And then the community engagement assessment report, checklist of the requirements for the assessment. And so basically, as Jerry has already established, today's webinar is basically to hear from our various country partners who are presenting today some of the challenges they encountered and then the recommendation that has been made. Next slide. Oh, okay, I'm done. Thank you.
Thank you, Rachel. So APCASO and ACTR will be monitoring the country level projects now, right? Is that correct, Rachel?
Yes.
We have a question from, where was the question? We have a question from Gavin Reed. His question is, I would like to know who was part of the multi-stakeholder steering committee, and if any work has been shared with the CCMs or CTs?
Okay, so the question, does it mean the country level steering committee or the global level steering committee? Because we had various, if it's the country level steering committee, we would need to find that from the country partners, because of course we're working with different countries and they had first multi-stakeholders. Yeah. So we can get that answer for ACT Africa. I can get that answer for Gavin after the call.
Thank you, Rachel. As an overview for the next 3 presentations from the countries, I would just like to ask, for each country, is there just one organization that you're working with at the level of the country level organization, or are there several community level organizations wherein the projects will be implemented on or with.
Jerry, can you come again?
What? Sorry.
I didn't hear you. Can you come again?
You didn't hear me?
Yeah.
Okay. So Doc, my question is are the projects to be presented or expected from the country level organizations working with just one country level organization, or are the projects supposed to be benefiting or in terms of participation working with different organizations in different communities and last mile populations and key vulnerable populations?
Okay, so at the stance, we do not know the last mile population. That's why this project is ongoing. And so the countries in working with them, you know, they are mapping out the organizations involved in last mile population, which will be uploaded on our GeoMap. So it's not just one organization they're working with various organizations. The aim is to reach the last mile population. So we are not limiting ourselves to just one organization, one last mile population organization.
Thank you, Rachel. Let's hear from the Southeast Asian Regional Organization. Jeff, do you want to add something more? Thank you for the answer, Rachel.
Thanks, Jerry. Just to clarify, we're not just covering Southeast Asia, but the entire Asia Pacific.
Okay.
It will also depend on the results of the validation forum, whether multi-stakeholder committees will be established as part of the implementation. But in terms of the initial partnership from the regional to the country level, we're partnering with just one organization. For the moment. Yeah, so it really depends on the validation forums that will take place. As far as Asia Pacific is concerned, we will see in the next 2 weeks what the result of the validation forum would be. Thanks.
Thank you. So at least that gives us an overview of what the different countries will be presenting. We have 3 countries to present today. We'll start with Cambodia, represented by Khmer HIV/AIDS NGO Alliance. Who will be presenting? Is it Chiti?
Yeah. Good evening from Cambodia.
Hi, did I pronounce your name and your organization properly? I'm sorry.
My name is Chiti. Please call me T. From Kana, Cambodia.
Okay.
Can you hear me clearly?
Yes. Can I start sharing my screen now for your presentation?
Yeah, you
Okay.
can say it. Good evening, everyone. Because today, from Cambodia, Chanton had to prepare this presentation, but due to he on the way, so he asked me to present for this presentation. So this is the learning and sharing session that we quote from the primary result from community engagement and leadership pandemic governance assessment that Cambodia is implement and conduct in Cambodia. So this assessment is not yet complete yet, but we have some part that are already complete. So we share just the part that we have already have the result. So please, next slide. Okay. For the part 1, we do the stakeholder mapping for the NGO who are working on TB project in Cambodia. So this is just want to identify the existing organization or group that are working for TB or TB key vulnerable population, and also to list the various service community and other means that organization work with those population, and also to geographical located and the scope of the NGO who are working with TB program. Next, please. And for the key finding, we mapping was conducted by a consultant, and also this it was work at 16 NGO or partner who are the national and international and also network, also research institute working with TB program. And the scope of mapping is cover at national and subnational and community level. Next, please. For the NGO that we work with, there are 16 and 7 is international NGO and 2 NGO are working at a community-based level. Next, please. And for the organization, the registration, all NGO are registered except one NGO who are not registered in with the Ministry of Foreign Affairs or Ministry of Interior in Cambodia. So they just research institutions, so they do not need to register. Next, please. And for the number of staff who are working in TB program, you can see here majority of staff is around 600 total, but majority age from 30 to 40. 64 years old, and few part-time staff who are working on TB program. Next, please. And for the grant, majority NGO receive grant for TB and COVID-19, but few NGO who are working at the community, they receive sub-grant from NGO who are working on TB because they are the network, so they just receive a small grant from the NGO who are implementing TB program. Please, next. And for the total, the budget that they have received, you can see majority of NGO receive grant around 2,000 to 5,000 K per year, while some NGO who are working in community receive less grant, less than some NGO less than 10 K of grant per year. And a few NGO who are receive grant around 1 million or more than 1 million per year for NGO who have bigger or broader coverage in the country. Next, please. And for the primary target population, you can see here the majority of NGO, they work to key population who identified by the national program. Because in Cambodia, the national program, they identified that the vulnerable group of TB is elderly people, children under 5, people living with HIV or diabetes, and also other people like person in close setting or people living with the patient who BK positive, something like that. So what are the NGO, a little NGO that they can work focus on migrant or people with mental health problem, or some NGO working on with the people who are in a close setting or resource setting or something. Some people who are work for the people who are in generous person. So this is the the number that our NGO who are working for that people, but majority working based on the identified by national program. Next, please. And the level of collaboration and coverage is, you can see, majority of NGO, they work, collaborate with not only in country, but with other country program. And for the coverage of NGO, they majority, they work from coverage from international or national and subnational until community, but two NGO who are working on community base, that they work from subnational to community level or national level to community level. This is what we have found. Next, please. And for the activity relating to advocacy and coordination, you can see majority of NGO, they can work for they can join with the national or the subnational to develop the SOP, or they do the resource mobilization and also participate in decision making during the develop proposal or work plan, or some develop SOP, something like that. So, but a few NGO who are working on for accountability, or sometimes they just provide only technical support or training to the healthcare provider at the national and subnational level to provide knowledge on TB screen and treatment, something like that. Next, please. And for the service, TB service provision to TB, you can see the majority of NGO, they provide both awareness raising and also reducing stigma, discrimination, and also screening TB and testing, and provide diagnosis, and also provide referral the TB people to health facility, and also support the treatment adherence, and also conduct home-based palliative care for TB, but not any NGO who are provide treatment initiation, because this activity or this task was performed by healthcare provider. So healthcare provider, they decide to do this activity. So they just support to refer and to follow up the patient during treatment. Next, please. For community, you can see here the community that they provide to people with TB. Majority is mask, and also some IC material, or sometimes they provide food and nutrition supply, but the food that they found to support the community or the people living with TB, they get from sometimes from donor, but sometimes they get from pagoda or community, sometimes from NGO who are who have the budget to purchase this material of community, and they provide to other NGO. So this is the point that we should discuss. We see that majority of NGO working on TB is international NGO and a few community-based NGO who are working at the community level. And there are small number of NGO and network that working on community lead based advocacy for TB and COVID PPR. And most of the community, you can see access for the people with TB or other vulnerable group is very limited. And there is limitation of social protection support for or seed grant for the TB people. Next, please. And for this part 2 regarding to community engagement, so this we use the tool 3 to interview for this result. To the objective one is to collect information and recommendation from for strengthening and engagement of TB key vulnerable population in the national TB and other emerging pandemic draw lesson from COVID. So the scope of work for this activity, please next. The scope of the assessment is a community engagement assessment, and we do by the local consultant, and also the data collection was done wide range from stakeholder, which include politician, decision maker, and so the health management officer, TB provider, TB implementer, and also community worker. And there are 5 phases for this assessment. So please next. Yes, for the key finding, I just go through for activity 1 that they have implementing it regarding to TB awareness raising and mainstreaming TB agendas in local authority, and also integrate TB and HIV program and promote engagement of people affected by TB in verified platform, and also promote the engagement of people affected by TB into grant development or grant proposal submit or any develop any national standard operation program, something like that, and also implement community lead monitoring for TB program, and also implement risk communication and community engagement for COVID response. Next, please. Yeah, for the activity, what that the risk, the more at risk often left behind in terms of COVID and TB program. We see that key vulnerable population, they based on the national program, as I already mentioned, and other who are left behind. You can see the construction worker or other people who are living in slum area or congregate setting, garment worker, and people working in entertainment place is not yet considered or covered by the program. And the affected by TB, especially for the construction worker, have not yet not yet include the vulnerable group of TB infection in Cambodia because they are working in construction and because the environment are working, so they are vulnerable for TB, but do not yet include in the program. Next, please. Okay. For this activity that they focus on building a community system, so far they use existing community group structure like local authority, village health support group, and support group of TB people in community. And they also establish peer support group at the district level for the leading by some NGO who are working with the community, so they can form and lead this group. And also they implement the community lead monitoring. We call one impact, but this activity not yet work broader, just some small scale in the community. And also they use VHG to work in a TB program. And for the capacity, please next. And for the engagement of TB KPV, they have trained VHG peer support group or network to respond for COVID-19 and TB program, and also village health support group and network in community. They provide education or campaign among the people affected by TB. And they also implement community feedback response mechanism to collect issue, problem, and need of people affected by TB and inform to healthcare provider. And they also run community lead monitoring to find out the feedback and report the case to or the barrier to the healthcare provider on TB and COVID-19. They also promote meaningful TB effect in community meeting or health management committee, provincial technical working group, especially during Global Fund. They develop some proposal. They also engage the community people on that. And also the fundraising campaign support for the poor community member, especially now they are advocate the Ministry of Planning to provide ID pool for the poor people. Please next. And for the challenge of engagement, we see that the limitation of knowledge and skill of affected people, TB people, because they are grassroots population, so the understanding of TB is a limitation, and budget for community worker often overlooked. You can see for TB program, the budget is shortage or limitation. Stigma and discrimination still exists among individual community and society in Cambodia. So, and the incentive and allowance for community health worker are very low, so they cannot receive enough allowance or incentive that they can support their living. The representation space for community well at the well of forum, any forum from the community to the national level is still limited. It means that some cannot provide the opportunity or the space for community representative in the working group or technical working group, something like that. People who are working with the construction are not belong to any existing structure or NGO. It means that they are not considered them into the program. For TB infection share, information share, and it mean are very limited if compared to COVID-19 pandemic. Next, please. And to improve the engagement, they said that they would like to provide capacity building training to the people who are working at grassroots, and also provide ongoing support to peer support group or network to perform their work at the community level. And they would like to support VAHG network or peer support group to conduct awareness raising at community level, especially to community mobilization for TB and COVID response. And they equip in knowledge and skill, leadership, advocacy, and also mobilization of VAG and peer support group and network. And they would like to increase the meaningful engagement in Global Fund process, CCC, or National Strategic Plan LTB development. And they also enhance community lead response to social protection and therapy and finance empowerment for the people who are affected by TB. Please, next. And this is the conclusion. You can see the community engagement LTB program has been implemented by COVID-19 PPO involved community in different way at operational level. But and the TB program were implemented with target population only according to national TB program, as I also mentioned, include program-based intervention by and target population like last mile population, construction worker were still not reached during COVID pandemic. The space for community engagement still limit, particular in decision making and program implementation, and also delivery of TB, COVID-19, and PPR. And we also see that investment in community engagement for TB and COVID-19 often overlooked due to lack of data, evidence base, or gap in advocacy work and national alignment and prioritization. Next, please. Yeah, this is for the recommendation. What we should do is to enhance knowledge and skill of health worker and also the community worker for better engagement and responsibility, and also increase the community awareness on TB and COVID-19, especially include in internal migrant worker.
Sorry.
Also, ensure that the existence of specific community coordination mechanism for national to subnational include community TB or COVID-19 PPO. They should strengthen and integrate and expand the implementation of community lead monitoring, because this mechanism is important, that it can bring the voice or the feedback from the people affected by AAV to the national program or healthcare provider. They should increase the engagement of people affected by TB in various platforms, especially in technical working group or TB, or any platform that they can do to advocate or include the voice of the people who are affected by TB at the national level, and also strengthening partnership coordination with in the pandemic response in local authority and the key stakeholder at the subnational and community and health center. This is the level that we should focus, because it is important that the community and healthcare providers should be connected at this level. So this is so from Cambodia, and sorry for maybe if you have more question, please.
Thank you. In consideration of time, we'll just have the questions later. We'll have the next presentation from Cameroon. Is that okay?
Yeah, please.
Yeah, Jerry, please, can you share my presentation?
Yes. From the presentation will be done by Bertrand.
Yeah.
I'm just opening the file right now.
How many minutes I have? Please.
10 minutes 10 minutes including the question and answer. So you can hopefully you can focus on the lessons and experiences that you learned, and then what plans are you planning, what plans and projects are you planning to do with your partner communities to help them improve their capacities to engage with the communities, in pandemic governance. Can you see the slide now?
Yeah, thank you, Jerry. My name is Bertrand Campoe. I am the Executive Director of the NGO for Impact in Social Health in Cameroon. So we are presenting what has been done in Cameroon. Just to first remind that Cameroon, we focus on a specific last mile population, on a specific key and vulnerable population. It was IDP. So we work specifically on IDP, and this is my champions. The lady you are seeing there on the picture is my champion, TB survivor. IDP are actually based in Douala, the economical capital city of Cameroon. So she have a story, and then we try to put the story into a film we are conducting, we are finalizing now. Just a quick background. Next, please. Next. So next, Jerry. Yes, as I'm saying now, Cameroon is facing a crisis, some conflicts in 2 of the 10 regions of the country. So since 2017, the crisis conducted to more than 6,000 people who died. And then we have more than 1 million people now who are IDP. So they are mostly on 4 regions, the IDP on the western region of Cameroon, on the central region, and the littoral region. So our activities was focusing on conducted an assessment mapping, just the same process as Rachel just present now. It was exactly the same process. Next, please. So this is the process I didn't explain because Rachel already present there and was exactly the same process. Next, please. Yeah, our methodology. So it was all the process. So also, next please, because it's the same process Rachel presents. Okay, now this is some of the key findings in terms of we have three specific components on this area. As I'm saying that we're focusing specifically on IDP. So the first component on this area was first to understand that specific population, because there are so limited information on the NSP, there are so limited information in terms of other document. Maybe it's because the crisis is just new, and the country we don't have so much information around IDP. So the first component was to make sure that we understand that that specific population, there is extreme poverty faced by IDP, and then they have so challenge that they have so many challenge, and health is not really part of their first priority. So that's how we can summarize like that. And the engagement in the TB, COVID, and other disease. So when you evaluate the component of the community engagement, so they have limited access to information. In many cases, they are not consulted, and collaboration is weak, and even participation is very weak. So we have a scorecard on the next slide that says there are so many challenges in terms of financial difficulty, cultural difficulty, geographic difficulty. The level of knowledge of TB is very, very, very low. And yeah, and also there are limited specific program focusing on that population. Next, please. So this is the evaluation we made, and then we can summarize that the engagement of the IDP is very, very, very poor. So we conduct that assessment, and then it's the conclusion we have. Next, please. We also conducted a mapping of some key structures. So we identify more than that. This is the 10 organizations who are really focused. But on our mapping, we have around 50 organizations, 50 organizations. But those who are really focused on working on IDP or refugees is something like 10 organizations we really recommend in 3 regions of the country, the region where we have a lot of IDP. Next, please. Next. Yes. And then, no, please come on a recommendation. The recommendation. Yes. No, recommendation. So we made a recommendation because also part of the engagement plan for the next step. So there is a recommendation on fifth area, on six specific area in terms of information sharing, in terms of consultation, in terms of collaboration, empowerment, participation, and community leadership. So what we can say that, I don't know, maybe we are also lucky because actually Cameroon is preparing or is finalizing a national pandemic preparedness plan. And as we are coordinating this work, because the steering committee of this project is led by the Ministry of Health, the disease department, at the Ministry of Health. They are the one who are leading the multi-sectorial steering committee of this process. And because there is a strong ownership of the Ministry of Health on this project, so they make a link to make sure that the funding of what we are doing now, the funding can be part of the document the country is preparing, because the country is actually finalizing the national strategic preparedness plan. So there will be a link so that we can introduce the recommendation, but also make sure that some of the organizations who are working with IDP can be represented on that national strategic plan the country is preparing. And actually, the report is fine. The report is finalized, and we share all the document with the with Act Africa, and then we are preparing together with the ministry when we are going to receive the go ahead from Act Africa. We are preparing for the next step. As I'm saying that we have a really nice multi-sectorial steering committee who is made by not only the Ministry of Health, but there is a NTP, there is Ministry of Internal Affairs. There is like 5 ministries who are part of the steering committee, but also representative from lifespan population. Even one of the one IDP is part of the steering committee, but also TB Survivor and other key organizations who are working on this issue. Thank you so much. Over.
Jerry, you're muted.
Yes, over for it's okay for me.
Jerry, sorry, you're muted.
Thank you, Bertrand, for that very concise presentation and but at the same time, it's very informative. And you actually presented how the key vulnerable populations and the internally displaced populations are affected, and also how they are able, or at least not able to engage in the policies. It's good to note, as Olive said, that the national government is preparing a national pandemic plan. I would just like to know, how is your organization and the KTPs being encouraged to participate and engage in the preparation of that plan? And how are you contributing as a national organization to that plan?
Those what I'm saying, I will also respond to Jeff's question, is that at the beginning, we as organization was not aware that the country is going on that process of preparing a national strategic plan for pandemic preparedness. We was not aware, but because of this project, because of the multi-sectorial committee we put in place, that is the entry point. We receive first the information, and then one of the member of our organization was invited to participate to the finalization of the workshop. So we succeed to have one representative from our organization who are part of the committee who are finalizing the national strategic plan for treatment for pandemic preparedness. So the agile is that the steering committee we put in place, the multi-stakeholder steering committee. So on the multi-sectorial committee, you have opportunity to have information because sometimes we don't have information. So it's through the multi-sectorial committee we have the information. And then because the ministry was leading the multi-sectorial committee, the ministry linked one of our member to what was doing on the strategic, the national strategy here.
Thank you. So are the internally displaced populations able to provide input currently at their level? Are they able to provide input to that steering committee?
They are represented by organization. Yeah, they are represented, but not really IDP themselves, but they are represented.
That is noted. Thank you very much. Do you have other questions? If not, then maybe we can proceed with the third presentation from Mozambique. I'll just we'll just open the file. Is it on?
Thank you. Good afternoon, good morning, good evening, everyone. I'm Miriam da Conceição from ADPP, and I'm going to present on our key findings and the engagement of the LMP in pandemic governance. Next slide, please. Okay, as an introduction, when COVID-19 was first announced in Mozambique, Mozambique was struggling to recover from devastating route of cyclones Idai and Kennedy, and it was a very difficult situation, and especially because also of the violence in Cabo Delgado, which caused so many people to leave their places and being in resettlement centers. So the combination of those natural disasters, attacks, and political conflicts made Mozambique in 2020 to be the 6th most worsening country on Fragile States Index. So for this assessment, ADPP worked with minors and ex-minors, but due to the time which the assessment was conducted, it was very difficult to find the minors because they are still in South Africa working. So we mostly work with ex-minors in one district of Gaza province, which is Manjakazi. Next slide, please. So I'll go straight for what we identified as the engagement issues. The first one is community structure, not clear, and absence of LMP community groups. The minors that we interviewed were not aware or were not clear of any community structures which they could be parts regarding engagement in pandemic as well as on TB issues. We also felt that there was lack of information among LMPs, especially information on TB, COVID-19, and preparedness and pandemic preparedness and response. For COVID-19 information, most of them obtained the information on health facilities when they were going for their treatment, as many of them live in rural areas and have no access to television or means of information. There was also lack of clarity on accessible information. So there is a need to diversify communication strategies in terms of information about pandemic, TB treatment, using other means that can involve all types of population. Limited mention of broad involvement or consultation by government agencies. The ex-minors mentioned that they were not involved in any consultation with government regarding COVID-19 response in any ways or other organizations that involve them on the response in pandemics. Next slide. And also, next slide, please. There was also lack of details on individual opinions influencing public health decision, which indicates a need to increase community participation. So the ex-minors were not engaged in any COVID-19 activity at all. The LMP group involved on the assessment were not engaged in specific TB COVID-19 activities with national programs or partners. So this was the feeling that we felt, and also the feeling of the minors in terms of their engagement in the and participation on national programs for TB or COVID-19. There was also absence of coordination mechanisms or gap in knowledge of existing coordination among LMPs. They were not aware of any coordination mechanisms regarding TB, COVID-19, and pandemic preparedness and response. LMPs do not understand their role in TB or COVID-19 response, and they believe that following recommendation is sufficient for effective engagement. We were working with ex-minors, as I mentioned before. We worked also with other organizations. So I'm clarifying the question that I saw right now. For this assessment, we worked with X minus, but we also engaged some organizations that are working with IDPs. The IDPs, most of them are in Cabo Delgado province, which is very far from Maputo. And with the budget limitations, we could not access the IDPs. We only were able to access the X-Finance. Next slide, please. So which projects are being implemented, and what are the topics that those projects are talking about regarding the engagement of LMPs? First of all, most of the companies or the NGOs that we talk with them, they are working on education. They are providing regular and updated information about pandemic preparedness and response, prevention practices to LMP, in this case, minors, X-minors, and IDPs. And this education needs to be continuous, not only during medical consultation, but through awareness campaigns, education materials, and more community programs. Also, facilitated access to health service. The organizations are also working with LMPs, and there is a need also to still continue to ensure that the minors and ex-minors have easy access to health service, including regular checkups, TB and COVID-19 testing, and timely treatment. Most of ex-minors that we work with them are affected by TB. All of them have TB, and some have some difficulties to access the treatment on a timely manner. LMP involvement, establishing mechanisms for active LMP participation in decision-making related to health, encouraging open dialogue and collaboration between community, government agencies, partners, and other stakeholders. As I mentioned before, the community structure is not clear, and the minors and ex-minors do not know where to go to be involved, to be engaged, or to be heard about their needs in terms of their involvement in pandemic response. Next slide. Prevention skills training. There's a need to offer specific training on prevention practices, personal hygiene, and safety measures to LMPs, ensuring that they understand and can implement these practices in their daily lives. On access to health resources, there's a need to ensure that the minors and ex-minors have access to essential resources, such as masks, sanitizers, and information on how to obtain medical assistance when needed. Some of the organizations that we talk with them were engaged on COVID-19 pandemic time. They were engaged on producing local production masks and sanitizers, but not all of the minors were able to have access to that, to the masks or sanitizers, to the COVID-19 or prevention materials, because they didn't know where to go in terms of structure, who to approach. So there's a need to clarify this community structure in terms of the engagement of the LMPs. Promotion of health habits, encourage the LMPs to adopt health lifestyles, including proper nutrition, physical exercise, and stress management to strengthen the immune system. Next. As a nations, we feel that there is a need to strengthen civil society organizations to be involved in pandemic preparedness and response to support community health workers. The community health workers were key during the COVID-19 time. The way the focus where the community LMPs could go to have access to information regarding pandemic. So there is a need to continue training. CCS organization is still working with, they are working with IDPs on identifying members who could be community health workers to be trained. So there is a need to continue to strengthen these organizations to continue to train and work with community health workers. There is a need also to strengthen the civil society organizations to fight stigma and discrimination, because most of the minors mentioned that they were discriminated when going for treatment on the health facilities. So there's still work to be done on strengthening civil society organizations to work with all and to all have access to health facilities. Work with local organizations to address health concerns, promote collective actions, and advocate for improved conditions. One of the main concerns of ex-miners were related with compensations. Many of them were talking about compensations because of working on the miners and getting TB. So there is a need here to improve or to advocate for improved conditions for ex-miners. Next, please. Also, we feel that there is a need to carry out advocacy activities with political leaders, religion leaders, and other influential people in the communities to mobilize and organize communities in different LMPs groups, because we feel that the LMPs are scattered. They do not have any structure which they should rely on to be engaged on pandemic and preparedness response. So there is a need for a clear structure in the communities. I think this is my last slide, and thank you.
Sorry, Jerry, you're on mute again.
Thank you for your presentation. It's very important that that it seems like we need to focus first on organizing your LMPs, especially that most of your LMPs have limited knowledge, at least for even for tuberculosis and where to access the services. And it's very important to first equip them with knowledge before they can engage meaningfully in decision level processes. Are there questions for Mariamo's presentation? None. Do you have any input, Jeff, Olive, or Rachel?
Yes, I do have a question, Jerry. I wanted to ask Mariam whether when they were coming up with if they had a steering committee when coming up with the survey itself, for the analysis itself. And then also I want to understand in terms of how they are taking forward the action points. Have they already developed their, and this goes to all the other presenters as well, have they developed their engagement plans, and who's involved in developing that engagement plan? Yeah, thank you so much.
That's my same question. If these recommendations have been translated to engagement plans already. So we would like to ask everyone, all the participants, if your recommendations are being translated to engagement plans already. Let's start with Chiti from
Cambodia.
Okay. Or Mariam first.
Okay.
Mariam first. Thank you.
Yes, thank you, Olive, for the question. Yes, we involved the steering committee at the beginning, before we started the assessment. And one of the groups that the steering committee wanted really us to involve was the IDPs. But due to the constraints on the budget, we couldn't engage this group, so we involved ex-miners, but they are aware of this. They are also part of the whole process of the engagement assessment, and the TB technical working group on the Ministry of Education is part of the steering committee. In terms of our action plan, what we are doing and how we are engaging and who we are working with, we are still finalizing our assessment reports, and our consultant is still working to finalize our engagement or advocacy activity plan. And this will be done by next week. So the findings that we presented are still preliminary while we work on finalizing our assessment report and the action plan. Thank you.
Thank you so much. Mariam, before you leave, as you're developing the engagement plan, are you foreseeing that being done during the validation meeting, or this is being done by the consultant as an individual, or there's going to be the contribution from the others?
There will be a validation steering committee meeting before we start implementing the advocacy. We'll present all the findings and then wait for the steering committee to validate to start engaging the organizations on the activities, advocacy activity phase.
Thank you, Miriam. How about Bertrand and Chief? What are the statuses of what is the status of your reports and your engagement plans?
For Cambodia, as I also informed, the process of the assessment is not yet complete, and soon we will do more activity regarding to validation workshop, and then maybe they have to plan for the next activity. So because Chanton is a lead for this program, and I am out of this scope, so I cannot answer you properly, but Chanton will do this and share with you later.
Thank you. How about Bertrand?
Yeah, Jerry. The first point is that we create a WhatsApp group for the steering committee. So at each time we share the report with the steering committee, and the report is sharing on the WhatsApp group, also on the email. And what we are preparing is a specific, we are preparing, I can say, the introduction for the phase 2. The introduction for the phase 2 will be a formal launching of the report, and then a validation for the engagement plan, and also because the engagement plan was sharing anytime with the steering committee, but we formally need to have a launch of the report and a formal validation of the engagement plan. The steering committee, they are sharing, they provide input through the WhatsApp group, but we need to formalize in terms of the launching of the report and the introduction for the phase 2. Because as I'm saying that, we also finalizing a film, a 23-minute film with the story of that IDP champion who is on the PowerPoint. We are finalizing, but this will be for the phase 2.
Thank you, Bertrand. We'll just have one more question from Olayide Akani.
I'm sorry. Hi, thanks everyone. Great listening to the presentation. So Nigeria is not a presenter, but I just wanted to also respond to the comments, the question that Olive had asked. So for us, we have prepared, a plan. I have prepared a plan, but that plan is still being reviewed by Jana Foundation, which is the lead NGO on this. I'm speaking as a consultant, and that plan is also needs to be validated by the steering committee, particularly ahead of the pre-validation meeting. So some of the activities that we have included in the plan for now are just activities based on the recommendations that came from the respondents to the various aspects of the assessment. So it will be updated as we get more feedback from the steering committee and the other partners. Thank you.
Thank you. Thank you. So for now, this session was supposed to help us learn how your organizations are now trying to help capacitate the local organizations, community-led organizations, to participate eventually in pandemic planning. And it's good to know that some of the countries are already preparing their national pandemic prevention preparedness and governance plans. And hopefully all your inputs and all your organizing processes will enable your key vulnerable populations to participate in that process. Do you have other questions? If not,
I have a quick observation, and this is my last one. I've noted that all the countries have a steering committee, and I think we also talked about a multi-sectoral platform. And already there may be in some countries existing platforms, but how, this is something that we as we are launching or we are formalizing these reports. I think it's critical to understand what type of multi-sectoral platforms already exist and how can we input into that instead of maybe developing a new platform, or how do we convert this steering committee to become a PPR specific multi-sectoral platform, so that whatever work we are having, whatever results from this piece of work is taken up by the development partners and all the other government sectors. And I liked what Bertrand mentioned, and I think it's also what the others have alluded to say that after the report itself, it looks like we're moving into another phase. And this is now where we're bringing in more people to understand and move together. So I just wanted to also congratulate each of the countries for the good work. It's not easy, but you have done a good work. Thank you. Back over to you, Jay.
Thank you. So, so we've finished with the recommendations and the initial plans. The last session would be hopefully to see what are the initial outputs of your studies, and if there are interventions to facilitate actual interventions that have been implemented to facilitate the engagement. What were the results? And basically ask for some indicators on how can we find out if engagement capacities of our key vulnerable populations and community-led organizations have been improved in terms of their capacities to participate in national and subnational pandemic governance. And with that, we end the session. Thank you, and we'll see you again on December. We'll keep you posted through email. Bye.
Bye.
Thank you. Bye-bye.
Bye-bye. Thank you. Bye.
Thank you.
Thank you. Bye.